only.
Yes.
Yeah, 4 minutes. Now we are going. 8 sharp.
Are we live or they're going to give a countdown?
1 minute, madam. We'll let you know.
Okay.
You are live now, doctor. Doctors, we are live now.
Okay. A very good evening to all of you and wishing you all a very happy new year. Welcome to this evening of felicitating all our winners of the image competition, which is conducted by Vitreoretina Society of India. And we have been having extremely enthusiastic participation of various members of our society with ever increasing number of submissions for this particular competition. And I'm very happy today that again we have several beautiful images which have been declared winners for the last 3 months of October, November, and December. And this is the first felicitation evening of this year, and we hope to conduct the same throughout the year. I now hand over and request Dr. Naresh Babu, who's heading this team, along with Dr. Chitranjan Mishra and Dr. Sangeet Mittal, to take the proceedings forward.
Thank you, Dr. Manisha. First, I'd like to thank all the participants for, sending the wonderful images. And the first thing I would like to tell is, I don't know how many people in this have attended the VRSI, because in this VRSI, we have selected the best images and both of them got a very good cash prize, both for the slogan as well as for the thing. So, and second thing is, as I keep telling, we don't have any copyright issue over this. Please send it. And in case if you want to send it to the other competition also, or for the, the cover page of any journal, it is fine. So you don't need to have any hesitation in sending it. And so let us not drag it unnecessarily. There are only 2 points to be made. Please just stick on to your time regarding the presentation, and no need to thank everyone because it's all understood. So let us not waste time in that. And again, finally, before concluding, I would like to request again you all to send more and more images so that we'll have a good bank of images and we'll get a better quality images also. With that, I'll hand over the mic to Chitranjan. Over to you, Chitranjan.
Thank you, Naresh sir. Thank you, Manisha madam. So we will be declaring the results of October 2020 image and video competition winners. So the third winner for the month of October, it's a tie. The first one is Dr. Kanwaljit Harjot Madan madam. She is in Thin Eye Hospital, Jalandhar. Congratulations for a very beautiful image. X-linked juvenile retinocysis with the dendritiform pattern of cysis we can see. This is the text she has written for that. May I request Kanwaljit madam to please say something about the image.
Good evening, everyone. This is the fundus photo depicting X-linked juvenile retinocysis. It is the rare congenital disease of the retina, which occurs usually in the males. Females, they are the carriers. And it occurs because of the mutation in the RS1 gene, that is the retinoschizin gene. This gene is mainly involved in intercellular adhesion and cellular organization. So if there is mutation in this gene, there is splitting of the retinal layers and the retinoschizis occurs. And it causes the usually symmetrical bilateral macular involvement, mainly in the males. And the early visual loss can be detected at the age of usually 3 months of the age, but it is usually progressive, and but the legal blindness doesn't occur. Thank you.
Thank you, madam. Just to highlight one more thing, if you can see the dendritiform pattern also, that is a very rare finding over here. And last year we had a similar image which we got as a cover page image in the famous ophthalmology journal. So congratulations, and she wins a certificate and a cash award of 2,000 rupees. Then we come to So Anirban Chakrabarti, he is now working in Renuka Eye Institute, Kolkata, alumnus of, he's one of our juniors and alumni from Arvind Eye Hospital, Madurai. A beautiful image contributed by him, retinitis pigmentosa with bilateral macular coloboma. We can see the OCT images embedded also. So this is the text Anirban has sent. May I request Anirban to please say a few words about the image.
Thank you, sir. This was actually a 24-year-old male patient with dimness of vision since childhood. His complaints were more severe at night, and his vision was 6/16 both the eyes with N12 near vision. And on examination, we saw there was a positive subcapsular cataract in both the eyes, and fundus findings showed waxy disc pallor with arterial attenuation and bony spicules extending till the periphery, along with bilateral macular coloboma, as corroborated in the OCT picture also. ERG showed depressed response in both photopic and scotopic patterns. So this was the retinitis pigmentosa with bilateral macular coloboma is quite a rare finding. So we thought of reporting and sending this image here. And this image is also accepted in ophthalmology retina as a cover image.
So congratulations, double congratulations to Anirban, and he wins again a certificate and 2,000 rupees. Any comments on this from the panel?
Anirban, why can't it be a case of what do you call rubella? Because you have got macular coloboma or congenital toxo with.
So congenital toxo bilateral, I thought it could be like bilaterality was the thing that came to my mind. Toxo unilateral would have been better. It can be a DD.
Yeah. No.
But bilaterally, I think that was the striking feature.
Okay. Any other comments for Anirban? Okay. Then we'll move to second winner is Dr. Saurabh Damodaran. He is a medical consultant in the vitreoretina department of Arvind Eye Hospital, Madurai. Very smart guy, does innovation, surgery, academics and whatnot. Hails from Kerala, studied in Maharashtra and then RP Center, so pan-India presence, and very nice image. CRAO in Takayasu arthritis, very rare thing indeed. This is the image contributed by Saurabh, and this is the text submitted by him. May I request Dr. Saurabh to speak few words about the image. Saurabh.
Thank you, Chitranjan sir. This was a 16-year-old boy who presented to us with a sudden onset painless diminution of vision. He was a known case of Takayasu arteritis. So what we found in this was a central retinal artery occlusion. Just for documentation purpose, we had done the FFA. FFA, again, you can see those extensive capillary non-perfusion areas. The idea behind sending this image is we need to extensively evaluate cases of CRAO in young. Maybe because that may be the primary presenting symptom of some underlying systemic vascular condition.
So point well taken. CRO in young definitely needs a lot of systemic investigations. Any comments on this image from our panel?
Saurav, is the CRO is the first symptom or of this patient? Because I think previously we have published a case, I think Chitranjan will remember, where the CRA was the first launching symptom for what you call the Takayasu. Is
Yes,
it the
yes.
same or he already had a
No, sir, he was a proven case of Takayasu and was on immunosuppressant. Later, he developed this complication.
Because the case which we have seen earlier was CRA was the launching symptom for Takayasu.
Yes, sir.
And subsequently, he had a neovascular glaucoma, and one eye ended up in an OPL. Yeah, any further comments?
Yeah, one thing is, like, if you see the fundus picture also, no, you will see those AV shunts in this. That gives a very good indication that the whole retina is ischemic. This thing, you don't need actually to do FFA actually in these patients. You can make out the ischemia in the fundus picture itself.
Yeah, he was telling for the documentary purpose he has done it.
Yes,
Okay.
what sir is saying that our clinical examination is the first investigation. So we can see that.
If you see these kind of shunts present, no, you look at the fundus picture in the macular area.
Yes, sir.
You can see those shunts are forming. These are very indicative that the retina is totally ischemic.
Yes.
Yes, sir. Yes, sir. Point well taken, sir.
And just it's a very imaginatory kind of a statement that it looks like a dragon sitting in the retina, the architecture of the vessels that you see. It's a beautiful image.
Yes, functionally also actually the patient will be suffering like that thing, madam. Like dragon kind of stealing his vision or attacking his vision.
Yes.
Yes. So congratulations, Saurabh wins 3,000 currency, which he can convert to Kerala currency or Maharashtra or Delhi, whatever he wants, and also wins a certificate. Congratulations, Saurabh. Then
Chittaranjan,
coming-
you can tell that there were two exercises that is because of the high requirement.
So congratulations to Bhavani for the first prize in the month of October. Sorry, Naresh sir, there was overlap for the clapping. We'll take your comment after Bhavani. So Bhavani is working as a medical officer in veterinary department in Arvind Hospital, Madurai, and this is the image contributed by her. Flock of Birds in the sunset sky. So here, not only science, some kind of artistic presence and some philosophy is also there. May I request Bhavani to please elaborate. This is the text she has submitted. Please elaborate and explain about the image. Dr. Bhavani.
This patient was a 56-year-old male patient who presented with sudden onset of defective vision in both his eyes. His right eye visual acuity best corrected was 6/36 and in the left eye it was 1/60. The left eye fundus photo could not be taken due to a dense vitreous hemorrhage. Whereas in the right eye, here we could see multiple pre-retinal hemorrhages, which were looking like a flock of birds, and the neovascularization over the disc, which resembled a sunset, and the background fundus orangish glow, which we could see resembled a sunset sky. So I felt that this could be named as a flock of birds in the sunset sky. It's a proliferative diabetic retinopathy patient with multiple pre-retinal hemorrhages, and the patient was advised pan-retinal photocoagulation for this eye.
Okay. Naresh sir, your comments and also the previous comments.
So, Dr. Bhavani,
Sir?
don't you take this case for surgery as the first option because there is already vitropapillary traction and the fovea is tracked towards the disc. So rather than waiting for, this case to be healed by PRP, shall we go for surgery directly?
So the OCT of the patient showed well-attached macula, sir. It was an extramacular tractional detachment. So initially we planned for a pan-retinal photocoagulation, followed by via surgery later on, sir.
No, the reason I'm saying is about the vitropapillary traction. Once the fovea is tracked towards the disc, I think the vision may not be too following. Okay.
Saying that this, but I think this patient would be due for a surgery first in the left eye because of the dense hemorrhage. So probably till the time the patient, is going through the surgery for the left eye, probably it would be better at least to control the disease by a PRP till that time.
Yes, ma'am. Point well taken. Sangeet sir, your comments on whether to take for surgery first or laser, as Naresh sir was asking.
See, it depends upon the situation actually.
Like if the other eye is normal, like Manisha madam told, other eye
is normal. I think I'll advise a primary vitrectomy, because what happens, like if you do laser in this eye before doing beforehand, sometimes this traction increases. The macula which is attached may get detached after laser. So I would definitely plan for surgery, but both the options are correct. There is nothing wrong that she did a PRP in this eye. Both the options are correct because some surgeons do feel safe after a doing surgery after a PRP. It feels safer to do the surgery after PRP, but both the options are correct.
Yes. So point well taken. Like it depends on the physicians or surgeon's discretion, and especially in this case, as Bhavani told, because the other eye was having dense vitreous hemorrhage and this eye had some vision, so probably she preferred the other eye. So congratulations, Bhavani. She wins 5,000 rupees and a certificate.
I have one comment for
Yes,
this
sir.
case.
Yes, sir.
Very unusual to see when you go to the, can you go to the picture?
Yes, sir.
See,
Yes, sir.
normally when a pre-retinal hemorrhage occurs, for example, there seems to have multiple areas of small PVD, and again the vitreous is attached. Again, small PVD, vitreous is attached. So that's why you have these multiple levels of pre-retinal hemorrhage, which is quite unusual. This is somewhat very unusual type of a vitreoretinal interface anomaly that I am seeing.
I think because it may have happened in due course of time. All these hemorrhages may not have appeared in the same one go.
Yeah, that is also possible. That is also possible.
Vision is quite good. So.
Yes.
Vision is 636.
Yes.
I agree with you. It's possible that the first pre-retinal hemorrhage, but then when the vitreous detaches further, this pre-retinal hemorrhage should shift down.
You shift down. Yes.
Down. So the little unusual type of a vitreoretinal interface that I'm seeing here. And as far as intervention is concerned, as you say, both ways are all right, but I would probably operate on the left eye with dense hemorrhage and subject this to laser, and also warn him that surgery may be required at any time when the traction increases.
Yes, sir. So nice case, and thank you, Bhavani. Again, we had a very good discussion.
Good case and a good way of naming the
imagination is
imagination also. Yes, yes.
So that's why I told, sir, with science and arts, some imagination and philosophy is also there. So then coming to the November month felicitation, coming to the third prize of November month. So the third prize goes to, yes, Dr. Meghana Niralagi. She is fellow in vitreoretina in Joshi Eye Hospital, Hubli, and this is the beautiful image she has contributed. The Starry Night, not by Van Gogh. Actually, I started pronouncing this yesterday only. So Van Gogh is the surname of that famous Dutch painter. His looks like that only. His full name is Vincent William Van Gogh. So maybe Dr. Meghna will enlighten us further on this. See, this is the text she has contributed, but we would like to hear with the image on. Dr. Meghna.
Good evening, everyone. Thank you for the opportunity. And so here is a 28-year-old who presented, a female patient who presented with us for a regular checkup. She had 636 vision with N8 in her both eyes. And we can see here a beautiful fleck-like lesions present in the post-equatorial region and extending up to the periphery. And we also, the patient did not have night blindness as her complaint. And ERG and EOG is found to be normal. The fleck lesions, they increase, and the size increases from the beyond the post-equatorial to the periphery as well. So hence, a diagnosis of benign fleck retina was made for the patient, and the same autofluorescence image was taken, which shows hyper autofluorescence lesion of the fleck lesions. Thank you.
What machine you used for autofluorescence, Dr. Meghna? Did you mention?
Sir?
Camera. What camera you used for the autofluorescence?
Scanning laser, ophthalmoscope, blue light autofluorescence.
Heidelberg?
Heidelberg, sir.
Okay. Comments from our panel and our seniors?
I think this is a beautiful photograph that she has taken.
Yes, sir.
It has come out very nicely. It depicts that fleck retina syndrome nicely.
Yes, sir. Yes, sir.
And I think, Dr. Meghna, you should surely try sending it to some journal for a cover page image. It's a beautiful image.
Yes.
Okay, ma'am.
So one good thing about this is, even if it is CSNB, the patient may experience what you call the night blindness, but ultimately their final vision is going to be good. So with the flex with the normal ERG, it's a bonus. Even if it's what you call electronegative ERG with the flex where we diagnose as fundus albipunctitis. So the patient need not worry much except for the night blindness.
Yes.
Yes.
And one thing you have to notice, like in these pictures, the vessels are normal, the macula is normal. These are the
Yeah.
things which give you a better prognosis.
Yes. So nice discussion. Congratulations again, Dr. Meghna. She wins a cash prize of 2,000 rupees and a certificate. Then moving to Drishyam
I hope we are not repeating. You just tell this.
yes, sir. No, it's like Drishyam 1 and Drishyam 2. So this is like Saurabh again winning another. So this is again very nice image he has submitted, sir. All that glistens is not gold. So this is a Muller cell seen dystrophy, very rare one and very nicely taken images and OCT also. And this is the text he has submitted for this Muller cell seen dystrophy. We would like to hear from Dr. Saurabh about this image. Dr. Saurabh.
This was again a 40-year-old female who presented with a diminution of vision in the right eye, basically. But on both eye had abnormal reflexes from both eye. You can appreciate in the fundus images. Even the OCT showed some kind of schisis and ILM wrinkling in the right eye, which was more in right eye and less in left eye. And ERG was performed. ERG was an electronegative. And so we came to a diagnosis of this rare entity. On further follow-up, the patient, we had followed up later also. The patient had developed a CMM in the right eye.
Okay.
Yeah, this is, I think, the second case we have seen so far. But usually surgical outcome, they say, is good in these cases. Have you asked this patient to undergo surgery? Because no other management is available for this particular condition.
No, sir, she is not a localite. She used to come once in 6 months kind of patient.
From Madhya Pradesh?
Madhya Pradesh or probably Maharashtra.
Okay.
Okay. Any other comments from other panel? So, okay. Again, congratulations, Saurabh. So he wins 3,000 rupees and a certificate. Then we move to the first winner. So Dr. Kusal Deliwala gets the first prize for the month of November, whereas image competition. He is working in Netralaya Super Speciality Eye Hospital, Ahmedabad, and he has so many publications on retinal images, especially. And this is the beautiful image he has submitted. Please look at it. You can appreciate the buccal height, the cryo marks, and the hyperolian in the macular region. And there is a dropped IOL bag complex, and nicely he has taken the OCT image also. So this is the text he has submitted for this image. We would like to.
Thank you, Dr. Chitanjan.
Yes, yes. Please, Dr. Kusal. Yes.
Yeah. So actually, this was the image of a 73-year-old male's right eye, and he actually came with the left eye blurring of vision and was diagnosed to have a rhegmatogenous retinal detachment. So right eye had this history of undergoing vitrectomy followed by silicone removal before 10 years. And patient was apparently aphakic with 6/36 correction. So on fundus evaluation, as I can show here, the ultraviolet field image showed nicely this well-attached retina with encirclage as well as peripheral retinopexy scars. But because this aphakia was due to this dislocated inferior IOL bag complex, and clinically I could see the macular invert pseudohypopion. However, just to confirm whether it was a pre-retinal or subretinal or intraretinal, I did this web source OCT scan where I could see there is also an additional presence of lamellar macular hole. And in fact, the sciatic changes associated with this lamellar macular hole showed the deposits of this emulsified silicone oil droplets in the sciatic space. So as such, I'm following up this patient for almost now 5 years. He is being stable. and I haven't done his any surgery for the dislocated IOL back complex. And also, I'm happy to share that this has been just 2 days before accepted as an publication in French Journal of Ophthalmology. And thanks to Dr. Chitanjan for just giving the inspiration and idea to why not to submit it. So thanks once again.
Yes. So congratulations again, Kusal. Which journal you told? Which journal it is accepted?
French Journal of Ophthalmology.
Okay. Good. So any comments from our panel on this beautiful image?
I think it's a very rare image to see a
Yes.
hyperolion in the macular region in a lamellar hole like this would be extremely rare.
Yes,
And so you have caught a very rare condition and documented it nicely. Very nice documentation, Kushal. And I think the whole thing is very well. So I'm sure it would have definitely been accepted anywhere. And I am also quite pleased to see that you did not rush in and do surgery, to remove this from the eye, because I don't think it would have resulted in any visual improvement, although it might have made the macula look anatomically better. Probably it would not have made much difference. And the eye was quiet with a dislocated IOL more than 10 years, and the eye was quiet. So I think a watchful, kind of a non-intervention is what you have done, which also I feel is very appropriate here, and very good documentation of this case. Congratulations, Kushal.
Thank you, sir.
Yeah, doing surgery would have been disastrous in this case,
Yes.
because I don't think
would
exposing
have helped
silicone oil from this is possible completely. So I think better is to leave it.
I think it's a very good example of when not to operate.
Yes. And one information regarding, because this is image computation, so we have ultra wide field images and Optos and Claras we are having, which are kind of compared. So when we discuss about ultra wide field, if we discuss particularly this image, Optos, though it is a pseudo color image imaging modality, it has some upper hand while taking image things in different labels. If you can see over here, see the buccal height, the IOL back complex, and the hyperolian, but everything is kind of clear looking. However, similarly, if we can see some nucleus drop or something, it is better captured. That means nucleus will be in different label, retina will be at different depth. However, this is not the same with the true color Claros when we take. What I mean to say over here, if there is a difference in the depth level, or say there is a IOL drop or something, we have to adjust the depth, that plane we have to adjust. I have no financial interest, just in the interest of imaging, I am telling this.
Yeah, one thing you can always do is like in Claris, what you can do is when you are taking a peripheral image, you can put your focus, you can shift to the periphery, and you can take multiple pictures and then you can create a collage. That can be done, but that takes a lot of time.
Yes. But sir, when we aim for something like a nucleus drop or an IOL drop in the periphery, suppose we focus over there, the disc behind will be kind of blurred over there. It will not be very clear like this, what I have experienced. Or any tips to capture that image in Claris?
You just take a central image and then you 4 peripheral images, and you always, at every time you your autofocus pointer to the periphery. So you'll get a good focus in the periphery and a good focus at the center with the central image. And then you merge all these images by the machine itself, and then you can get a better looking image.
Okay, sir. So again, congratulations, Dr. Kusal. So he wins the certificate and 5,000 rupees. So please stay with us, Kusal. Don't go. Why I'm telling you this? Because December month, not again,
Winning seems to have become a habit with Kushal, huh?
Sir, Kusal Deliwala is more valuable than Kusal Mendis. He has back-to-back images, but yes, see again, a nice image. If you can see over here, subretinal gas bubble migration. I will not say more on this. He has submitted the text regarding this. We would like to hear from Kusal again.
Yeah, thank you once again. So basically, this patient underwent vitrectomy for traumatic IOL back complex dislocation and vitreous hemorrhage. And intraoperatively, there was one superior iatrogenic retinal tear. So I did IUL bag removal with vitrectomy and level fixated CP IUL, and had put a CC-affected gas tamponade. So once on follow-up, when the gas bubble started to absorb, patient complained of blurring of vision. And I could see now that initially there was some mild kind of an optic capture in the upper part, and on ultra-wide field undilated image, I could see that there was some subretinal migration of the CCF fish bubble. So anyways, I had to dilate this patient for relieving the optic capture, and I gave a supine position. So that was relieved. But when I looked at the fundus again, I could see this free migration of these subretinal gas bubbles into the vitreous cavity. So I took another picture and just documented it. Even configuration change of the retinal detachment. Here I can see initially it was a superior retinal dialysis, and ultimately I did vitrectomy again with siliconal tamponade to settle the retina.
Good, nice image. Any comments?
Congratulations, Dr. Kushal. Very nice and beautifully captured.
Thank you.
Yeah, congratulations, Kushal. Nicely captured. But I think your story doesn't end here. I think you'll have to go back and do something, because these bubbles are not big enough to tamponade your large dialysis that you see there, and kind of make the patient all right without further intervention. So I think good capturing of the image. Yes.
As I mentioned, sir, I already operated this and I put up siliconal tamponade because this dialysis was something which I observed in post-operative period. So anyways, I was planning for siliconal tamponade, and subsequently patient gained up to 6/24.
Good.
Good.
Nice, Dr. Kushal. So for this image, he wins 2,000 rupees and a certificate. Congratulations, Dr. Kushal. Then we move to the second award for the month of December. The second prize is awarded to Dr. Pramod Suman. He is a fellow in the Retina Foundation, Ahmedabad, under Dr. Nagpal. And this is the image he has contributed, striking streaks of angioid. So, Dr. Pramod Suman, if you are there, please explain about the image. Dr. Pramod Suman is there?
Chittaranjan, I don't think he's connected.
I don't think he's there.
No, he's there. He's there.
He's there?
Yes.
Okay.
Dr. Pramod, can you unmute yourself? Please unmute.
He's there. Please unmute Dr. Pramod.
Chittaranjan, in the meantime, you can read the slides, I think.
Yeah.
Okay. So this is the text he has submitted. A 65 years old male presented to them with difficulty for near vision for past 1 year, and right eye vision was 6/18 and pressure was 10 mm. And they have observed clinically the angioid streaks around the optic disc with macular thinning, and they did conservative management only. They have submitted this fundus photo and the autofluorescence, and they have mentioned it as macular atrophy, because the central part we can see the hypo autofluorescence over here, and the streaks over here we can see the angioid streaks. Those are hyper autofluorescence. So if Pramod unmuted himself in between.
Not yet.
So we would like to listen to our panel regarding this image.
I think one thing I would like to say is for the younger ophthalmologists is when they look at the retina, sometimes they are the macular atrophy is so striking that they tend to miss the surroundings. So it's always go to have a good look and see what is the cause of this macular atrophy, because these angioid streaks, I've seen many people missing angioid streaks just because some other lesion like CNVM or a macular atrophy is present. So,
yes, sir. Point well taken. Just before describing only GBP, we need to find out the cause. What is the cause of this macular atrophy? Yes, sir. Any comments by Manisha, madam?
No, thank you, Chitranjan. We can move forward now.
Okay. So congratulations, Dr. Pramod Suman. He wins 3,000 rupees and a certificate. This is the first. So December month 2022, Dr. Pallavi Goyal, she wins the first prize for a beautiful image, PPCRA. We can see it's like it's a treat to the eyes kind of thing. You can see over here, very nice image. And this is the text she has submitted. She is a fellow in Dr. Sroff's Charity Hospital, New Delhi. We would like to hear from Dr. Pallavi.
Good evening, all. So this was a 14-year-old male that came for a regular ophthalmic checkup with us, and we captured this beautiful incidental finding where we all can see patches of chorioretinal atrophy and pigment clumps along the veins. And this figure was with a normal macula. This were normal. Vessels were okay. His vision was within normal limits, 6.6 and 6, and this kind of finding was consistent with pigmented paravenous chorioretinal atrophy. So we went ahead with the ERG, and the ERG was normal for this boy. He has been advised for a yearly follow-up. And PPCRA is basically asymptomatic in most of the patient. Mostly it is an incidental finding. The patient will not come with blurring of vision. This kind of finding is some genetic connection has been found with CERB1 genes, that the same gene can be reported in a few of the retinal dystrophies also. In these kind of cases, we need to rule out uveitic panel also. So we have already ruled out any active inflammatory uveitic panel in this patient.
Thank you, Dr. Pallavi. So I invite the first comment from Dr. Manisha, madam. Any comments or compliments on this image?
No, I think it's a beautifully captured image, and I just want to highlight one more thing, that in our setup, we do not have a wide field angio as yet. And despite that, you can, one should not feel the handicap that you cannot capture beautiful images. And this is a living example of that even with a manual montage or an auto montage, you can still have beautiful images captured quite till the extreme periphery. And we just have to have an eye to capture and, document these cases very nicely. So I congratulate Pallavi for doing that.
Yes, madam.
I'd also like to say the same thing. She had done a lot of hard work capturing these images. It's countless number of images she had taken, and then she had montaged them in both the eyes. She had done very nice work.
What from this camera, Pallavi?
That's what I was also about to ask. Which camera did you use?
Yes.
So we have a Zeiss Visumax 500, and our
Yes.
optometrist, Mr. Brijesh ji, have helped me in this thing.
Yes.
Actually, really nice effort. Yeah.
Yeah, actually, we and Chitranjan were discussing when this image went for voting, and we were waiting, and we were discussing that they should get the first prize.
Yes.
And in fact, we were waiting for the results, but fortunately, the result was in alignment with our choice, because as everybody told, it was a great effort to capture all these things.
Yes.
And the montage has been super. It's a manual montage or auto montage?
Ma'am, it's a auto montage.
Auto montage. It's a wonderful thing. Actually, a lot of effort in this actually. Yeah, over to you, Chitranjan.
Yes. So we are actually learning so many things from this Felicitation program. Lot of knowledge from each and every image. So congratulations to Dr. Pallavi. She wins 5,000 rupees and a certificate. So with this, we have concluded the months of October, November, and December 2022. Congratulations to all the winners. And may I request Dr. Sangeet sir to please say some words of encouragement for all the winners and the young doctors who are contributing to the VRSI image competition.
Okay. I think all these images were superb, and not only the images, the imagination as they're naming, and the hard work, like the last image we saw, which has gone behind taking these images. I think it's amazing. One thing I'd like just to say for everyone is, like, just keep submitting these images. Just keep submitting. We need more and more submissions. And I think you never know when you are going to win, which image you are going to win. So just keep submitting.
One suggestion I have, can we have these images in our VRSI newsletter?
Sir, yes, sir. We are having with numeric people. Actually, the award-winning images are displayed in the VRSI website. We can definitely have a newsletter, like with the permission of.
Yeah, if Mahesh agrees.
Yes, sir.
Then I think it would be seen by a lot wider audience, And as earlier we have emphasized, there is no copyright issue. Submitting here does not prevent you from submitting anywhere else. So VRSI is not having any copyright owners of these images. It is just to encourage our own fellows and our own people that we are doing this, to recognize their talents and kind of stimulate them to take pictures, stimulate them, and encourage them.
Over to you, Manisha madam. You want to say something?
So thank you, Chitranjan, for all your effort. I think it is beyond my words to really recognize the kind of effort you are making for making this competition go ahead, and all the felicitation ceremonies that we have been having. So thank you so much on behalf of VRSI. And I also want to congratulate all the winners once again. And I think it's really encouraging to see how the young retina specialists of our country are enthusiastically capturing the images and documenting these patients so beautifully. So congratulations once again. And I just hope that in this year, at least, we are able to start the video competition. That is something we are still looking forward to. And we just hope that there are certain entries coming in and we are able to one day have a felicitation ceremony for the video competition as well. And I just want to thank all of you for joining for this evening, and have a great evening. Thank you.
Also, I want to thank the numeric people, Madam Manjula Madam, Sai Sir and their team. Mr. Prem Kumar is there, and all other members of their team. They have been also helping us in all the image work behind this screen.
In fact, they are much faster than us, actually.
Yes,
They
sir.
pressurize us.
Yeah.
They put in a lot of pressure for us to work.
Yes, sir.
I also thank Naresh and Chitranjan and Sangeet for taking time and organizing the whole thing so nicely. And thanks one and all for taking time to be here with us. And congratulations again to all the winners.
Yes. Thank you, sir.
Thank you.
Naresh sir and Sangeet sir.
Thank you. Thank you.
I'll stop, sir.
Good night, everyone. Yeah.
Good night. Good night. Good night.